So I want to talk about some of the newer cutting edge uses for GLP-1 medications, this trend that's popping up quicker and faster, what that really means. Now, the term GLP-1, glucagon-like peptide, has become super popular. People are using these medications more and more and become more, I won't say fad medication, but in many ways that this is your tirzepatide, semaglutide, but people forget beta Victoza. There's an oral semaglutide. These medications have been around for quite some time, but some of the newer indications, they recently got approved, FDA approved to use with patients with end-stage renal disease, diabetics with end-stage renal disease. Some studies coming out showing that probably a coming approval for obstructive sleep apnea, and even some interesting stuff with rheumatoid arthritis. These are blockbuster medications making lots of money for pharmaceutical drug companies. That's one side. The other side is they have a huge clinical utility. So what I like to do with things like this is take a step back and ask some questions and think about the whole process. And the first thing to think about is you never really hear about something, a novel pathway, treatment things, until there's actually some marketable, patentable item out there. Glucagon-like peptides, butyrate, which we use in functional medicine all the time, different bacteria. There's actually now a GLP-1 probiotic, metabolic pro, as well as glucose control that actually help. And they're using bacteria. So this idea of using these peptides for a whole host of things is not novel. What is happening is just this one blockbuster medication is getting super focused on because it has so many different utilities or uses. And so the first question you have to ask yourself is, why does this one thing have so many potential uses? Well, it's anti-inflammatory. That's huge. We know inflammation is a root cause for a lot of diseases. It helps with insulin sensitivity, which 80% of Americans are insulin resistant, and now even cancers, we're seeing insulin resistance as a part of the metabolic cause for different cancers. They actually help stabilize mast cells and mast cell activation syndrome, which according to Dr. Moldering's research, 19% of Germans have some form of mast cell activation syndrome. So all of a sudden, this peptide, which our body has currently over 7,000 peptides that we've identified, is having all kinds of clinical utilities. And you're going to hear about it everywhere. You're going to hear about it in the news, you're going to read about it in articles, and now it's getting fame on social media because all these utilities. Now, so the first point is that you have to think about why, are we talking about so much now when we weren't talking about peptides several years ago? And in the functional medicine world, I've been noticing that peptides were taken away from us a year or two ago. We lost access to thymosin alpha 1, TB4, lazerotide, which is actually being studied right now for celiac disease, was available. Cerebral lysin was available here in the United States. And in the last 2 years, we've lost access to a lot of different peptides simply because, well, I shouldn't say simply because, but strangely enough, some of these are actually getting ready to become marketed as medications. Thymosin alpha 1 currently is a drug overseas that's quote unquote approved, manufactured in Austria. The stuff I've gotten actually has come from Austria. They have manufacturing of it in Russia, Mexico as well, and in Thailand. You can buy it as a prescription drug. Here it's not available. It's in trials right now to be used. In Europe, it's actually used for increasing the white blood cell count in Switzerland, especially chemotherapy patients, cancer patients who have suppressed white counts. So these things, unfortunately, what happens is you don't hear about something until there's a marketable, patentable use of it, and all of a sudden it's the biggest new. And in the functional medicine world, using butyrate, berberine, which kind of acts like nature's metformin. These are things we've used a bunch. The whole senescent cell thing, if you've heard the zombie cell talk, if you haven't, then we've been talking about that in the functional medicine world, longevity world for maybe 5-ish years. Data goes back even longer. But these are things that just now I've heard some articles from some cancer doctors talking about this as a metabolic precursor for cancer, which is the case, which is true. But going back to GLP-1s, their use is exploding. You're going to hear more and more about them. And they are, if used rightly, they have a lot of benefit. Now, a couple things to think about. First, I was at a conference this past November, and they were actually showing charts of GLP-1s, the levels. And so it's interesting when you use a GLP-1 drug, you're getting 10, 15 times your body's normal physiologic doses when you take it as an injectable drug, which, okay, that makes sense why some people just do horrible with it. And even when you do microdosing, which we've been using now in the mast cell world for a bit and it's getting more popular, that's still 3 to 4 times higher than physiologic doses. So the thing about these things, how I'm using them at super physiologic doses, which is what pharmaceuticals are. You can take a natural substance like curcumin or omega-3s, fish oil, and you take what you'd consume in a diet, you multiply it 10 times, and now you're seeing curcumin being used for pre-multiple myeloma, which is a kind of bone marrow cancer, or fish oil being FDA approved for ADHD or being used in traumatic brain injuries. So the idea of taking natural substances and bumping up the dose to make them into a drug, and that's not a new concept either. But you're just going to be hearing more and more about GLP-1s. So the question is, well, how do GLP-1s help with sleep apnea? Well, the primary treatment of weight loss has always been, the primary treatment of sleep apnea has always been weight loss. So if GLP-1s can help you lose weight, about the same ballpark as a gastric sleeve, then sure, it could help sleep apnea. Sleep apnea also is a part of metabolic syndrome, has an insulin resistance component and an inflammation component. Well, GLP-1s help with this as well. They've already been, my research company, Virginia Research Center, did some of the original studies on GLP-1s to be used for cardiovascular risk reduction. And just makes sense if it decreases small vessel inflammation, if it improves insulin resistance. The four horsemen that kill us, cancer, heart disease, neurological issues, and metabolic issues. If you're affecting metabolic issues, insulin resistance, then you're gonna have a massive impact on people's health, regardless of its, what body part there is. They're currently doing research with GLP-1s with neurological issues as well, like Alzheimer's and Parkinson. And for you that are familiar with Dr. Dale Bredenson's work, he's delineated out 5 major and 1 minor, what the minor is still a big one, 6 classes of Alzheimer's, and type 1.5 is glycotoxic, i.e., and some people are using the term to refer to certain types of Alzheimer's as type 3 diabetes. So if you have a medication that improves insulin resistance, that treats inflammation, it just makes sense that it help with that as well. One of the interesting things that's coming out that actually I was reading in the medical letter several months ago is that I believe it was tirzepatide just got approved, or semaglutide. They're very similar, a little different, for use with patients with end-stage renal disease, or CKD, because of its, the question is why does it help? And that's where you get into the same thing, inflammation, small vessels. If you improve small vessels, could it help with people with retinal issues? Potentially. I mean, anything with those vessels, which is every single part of your body. I could go on and on. And the other thing is like rheumatoid arthritis. There's actually looks like there's some utility with GLP-1s with rheumatoid arthritis, which is quite fascinating to me. But then think if it stabilizes mast cells, if it's anti-inflammatory, one of the biggest drivers of inflammation is obesity, if it helps with weight loss. Take a little side note. Well, let's finish the rheumatoid arthritis. So it makes sense that it might help with inflammatory conditions, of which rheumatoid arthritis is a big moneymaker, gangbuster, right? So it just makes sense how and why you're going to hear more and more and how these medications are becoming more popular. They are fairly safe if used the right way. If you overdose people too quickly, if you bump them up too fast, yes, you can have gastric obstruction. Yes, you can have if you have gastroparesis, a slow stomach, it can mess up all those things. If you have dysautonomia, which is a dysfunction in your autonomic nervous system and your GI tract isn't working quite well, you can get horrible constipation with it. And then there are the rare parathyroid tumors, which I've never seen in my clinical career. I've never actually heard of one happening, but they happen in lab animals, so it's on the package insert. But the medications are used appropriately in the right patients, and that's the key. Are you using it appropriately in the right patient? Are there alternatives? Can we work on diet, lifestyle, exercise? Ultimately, the way these things are working through anti-inflammatory effects. We have lots of nutrients, lifestyle modifications that can help with that. Insulin resistance, we have lots of lifestyle things we can do for that, other nutrients. It helps with mast cell activation. Again, lots of things we can do for that. And even on the obesity side, we know that there's 5 different kinds of obesity. Caloric, inflammatory, toxic, metabolic, and then I refer to as trauma, which is your nervous system is just ramped up. High cortisol, which could be from trauma, big T, or a little trauma. But the GLP-1s address 3 of those 5. So it makes sense that these are gangbusters, but at the same time, are there other ways to do it? And if you take a GLP-1 and you don't change anything else, are you going to be on this medication for the rest of your life? And I think that's where the rubber meets the road. Do we plan on being on these medications for the rest of our lives instead of changing your diet, removing inflammatory foods, removing petroleum-based dyes, removing sugars that come from or refined from genetically modified beets, which is where the sugar in our country comes from, is genetically modified. Removing these kind of things, removing diet Coke, diet soda, artificial sweeteners, and those things are actually neuroendocrine disruptors. They mess the hormones up. So maybe it makes sense to remove these kind of things. If you're not doing that stuff with the GLP-1s, are you going to take these expensive drugs for the rest of your life? And there are some concerns with muscle mass loss with long-term use, sarcopenia, which as you get older, particularly women, sarcopenia is a big thing that can adversely affect their health. One of the biggest factors of whether someone will leave the hospital alive when they're admitted is their amount of muscle mass. So again, plan on hearing more about GLP-1s, especially as the new indications are coming out. But the reality is these are big money makers. The American Academy of Pediatrics was even at one point in time, they still may be recommending these for kids for obesity. A lot of it comes down to is money. They're big money makers. You're going to hear about them. So hopefully the next 3 to 6 years, there's a shift in the sentiment in our country with health. We're actually removing dyes and chemicals, petroleum-based dyes. It's kind of amazing the government has to make companies remove petroleum-based dyes from food. That's kind of weird. But the point is that people need to take charge of their health. You're going to be hearing more and more about this, but the reality is that there are other ways to address these things. And the question is, do we do that, or do we just go down the pharmaceutical route? And if this helps get you over the hump, to change your diet, to change your lifestyle, if it helps you get rid of the hump to get you on a healthy trajectory, if it helps lower your inflammation so that you have the margin to make all the changes to get out of the moldy building, yada, 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 start your low-dose naltrexone for your autoimmune diseases, including rheumatoid, then I think these are really super helpful, but we shouldn't use them as a crutch. The gist of we should not use them as a crutch, as a replacement for the foundations of health, which are diet, exercise, sleep, stress reduction, having meaning and value in your life. It's just amazing how calming and centering having a stable family, having a close community around you can be. Forget these things. It's hard to get long-term health changes. That's where I think if you use these to get yourself on the right trajectory, that's huge. But ultimately, the foundations of good health are still the foundations, and we can't use drugs to replace that. So hopefully this information was helpful, and it just helped with your perspective as you're hearing more and more about GLP-1s, which you will continue to hear more and more about them. Take care, and we'll talk to you soon.